Ok, alors bonjour tout le monde. Welcome everyone. Thank you for coming to the presentation of the psychology internship. So I'm going to be doing the presentation in English today, but of course, feel free to ask me questions in French if you have any questions. So my goal today is basically to give you a quick overview of what is the internship about, what's the context of the internship, what does it entails, and then I'll tell you a bit more about the interview process. We decided to use this webinar format because actually we've had many more people than we thought applying, so we thought and we wanted to take the time to review everyone's application and to give the fair time. So that's why the timeline of the selection has been shifted a little bit, but I think hopefully that's to allow us to look at each of your application um, and then give it good consideration. So what I'm going to do is a quick presentation of 10-15 minutes, and then I'll give you time to ask questions. So what is this project basically? The context is that we just got a grant from the Diabetes Canada to expand one of the couple-based interventions that we have developed actually prior to the pandemic, that then we developed we changed to a fully online version during the pandemic that we delivered to older adults who are living with obesity. And with this intervention, we were able to show that we increased their level of moderate to vigorous physical activity by 15%, and that change was maintained during a year. So that's actually a really promising finding from the couple-based intervention that we developed. And one of our colleague was a physician scientist working with diabetes patients was interested in applying this treatment model to people with diabetes. So for the specific studies, what we're going to do is use a standard of care, which is basically the physician telling people with type 2 diabetes to increase their step count of about 1,000 over the course of a year. So gradually increasing how much they're walking, because we do know that this is associated with reduced risk for cardiovascular diseases in this population. But what we're going to do is that we're going to look at the standard of care and what happened when we add or dietetic health behavior change intervention. So are we able to boost the change in physical activity that's happening? So the study will be done with patients that have type 2 diabetes and their partner. We are targeting the older demographics. So for the studies 45 and older, and they will be recruited by different McGill affiliated clinics throughout the Montreal area. So what this means is that we'll get both Anglophones and Francophones, probably more Anglophones than Francophones, but who knows? I think it depends on the study. In the initial couple-based intervention that we developed, I developed it with the idea that these would be delivered by psychologists or psychology students. But in speaking with my physician colleague, she basically told me that in real life, in our current healthcare system, it would be impossible to have psychologists deliver this intervention because the needs for other types of services for psychologists is so great, so high. So then she basically pushed me to say, well, can you train undergraduate level professional that would actually be the one that would be delivering this intervention in the real world? So if we want to make it scalable, so that is, let's say that we found this intervention to be effective, we want other centers to adopt it, then they need to have the staff. So part of the challenge that what we're trying to do is to basically use undergraduate level practitioner, so not trained mental health professional, to deliver the intervention. And that's what the internship is about, basically. So the idea is to train you guys to understand this treatment model and then to being able to implement it at the level that would lead to similar outcome that if it was a mental health professional that would be delivering the intervention. So just to tell you a bit more about what the intervention looked like. So it's a short intervention. It's 6 sessions over 3 months. And again, the 6 sessions, that's because we know that the biggest gains are made during the first 5 to 6 sessions in general. And we're really thinking in terms of scalability. So if we are successful with this intervention, how can we make sure that it's applied? So if the intervention is too long, it won't be applied. It includes three main components. So motivational interviewing, which is a way of communicating with the patients, engaging them for them in formulating their own needs for change that we know is associated with greater physical activity change. We're going to use specific health behavior change strategies. And then we're going to use a family system perspective because we're working with couples. So what this means is that although we have one identified patient that we are working with, we also consider the social context of the home environment in which the person is and saying, okay, how, for example, the daily routines, do they include or not physical activities, walking time? What do they do during their free times, evenings, weekends? Do they spend watching TV versus having some active hobbies? So that's why we consider, okay, so how can we help both member of the diet to make a change that's likely to be more sustained over time? The intervention will be delivered either via Zoom or other video conferencing software or in person. If it is in person, that's going to be done in my lab at the Loyola campus at Concordia University. And really, this will be based on the patient's preference. So do they want to come to do Zoom and then in person, or do a mix of these? So really, we want it to be driven by the patient preference. And we wanted to keep the online component because during the pandemic, we realized that a lot of people that actually makes it more accessible. And we record all the sessions, which is really helpful for two things. For us to be able to provide close supervision with the interventionist. So we're able to review the session with you guys and then give you feedback. And then also to track, okay, what are the processes that might be associated with greater efficacy or greater change over time. So basically what the psychology internship is about is to learn how to deliver the intervention. And we do this through really a structured training and supervision process. So there's a more intensive training early September where we just work on the basic interpersonal skills, understanding of how to apply the behavior change strategies, how to deliver motivational interviewing intervention, how to develop conceptualization based on family system therapy. And then after that, you guys soon start to see your first couple. And we use a model where early on you do co-therapy with another interventionist so that at least you guys are two to be working with the couples. And when you're ready, you gradually transition to do individual, I shouldn't said therapy, but individual counseling. And throughout this, what we're going to do is a weekly or bi-weekly meeting, supervision meeting, where we monitor how things are going. And then basically we spend more time dealing with like more challenging couples. So when things come up that you're not sure how to respond. So this is where we would spend time with you guys. And this is done in group. So, so basically, if I summarize the different intern tasks over the course of the 12-month internship would be to read the training manual, attend the training workshop, and then to attend the supervision session. And after each of the supervision session, there's two components. So one of them is that I will ask you to review your session, the recordings of the session, to evaluate how you did. And then the portions where you struggle, then we discuss this in supervision. And then based on this, we will design exercise for you to practice that then you can implement them in your session. So that's where I mean by the very structured kind of training goals. We will be doing a 50-minute counseling session. And I think the big challenge is that, so this is a very structured sort of training and supervision process, but it does mean that we will be watching you guys a session every day. And I'm also a stress researcher. That's my background. And if you want to stress people, you have them be evaluated by others. And that's basically what we do every week or other week. But this is done in also a supportive manner. And really the goal is to help you better administer the intervention. But it comes with its challenges. The time commitment. So the idea is it's at least 1 year, 7 to 10 hours a week. And of course, it goes gradually as you guys are increasing the number of couples. What we're going to try to do is no more than 5 couples at a time. And the internship, unfortunately, is not paid because we don't have enough money in the grant to be able to pay this. But what if you guys are able to get course credit to through your university, we're really happy to facilitate that. And of course, we give a training certificate and letter of references after the program. This is a bit of a different internship because we'll be working on both personal and professional development skills. So what this means is that as part of the supervision, we might ask you to talk about your own personal experience. For example, your own emotional reaction to a patient. What kind of patient might be eliciting some emotional reaction in you? Are there some certain topics that make you uncomfortable? And then how can we help you approach these topics? And so in that sense, we might ask you to self-disclose part of your experience to the extent that we think that might be influencing how you're interacting with the participant. And then later on, once we've identified, for example, something that's more difficult for you, for example, dealing with a very angry or critical patient, then we're going to suggest some exercises for you to try to do in order to be able to be more effective in dealing with these types of clients. And for the selection process, so we have a 2-step selection process. Basically, the first step will just be simulation interview. So we'll ask you to come, and then we'll play video clips from you and then ask you how would you deal with the situation, just to assess sort of your natural interpersonal skills. There's no preparation needed, and for us, it's just to get a sense of where you're at. And then after this first phase, then there will be a second phase where myself and Dr. McNeil, which will be the other clinical supervisor, will be interviewing potential interns. And what we will do is that after the webinar, probably early next week, we will send you a link where you will be able to schedule in your interviews. My goal for this year is to recruit 6 interns. But the project will last for the next 3 years. So even if we are not offering you an internship this year, you are feel free to reapply next year and probably for the next 3 years if you are interested. So that's it for me. That's a brief overview. I didn't want to take too much time, and I want to allow you guys to ask some questions. And sentez-vous bien à l'aise de poser vos questions en français aussi. Any questions or comments? Yes, Isabelle.
Hi, I was just wondering, because it says that we have to do some intensive training and the reading. I'm just wondering how long, like, the training itself is, and also if it is like, is the training part of like before we start seeing the patients, or is it like genre en même temps qu'on va voir les patients avec vous, genre?
Okay. So it will be, so just to be clear, what I say intensive training is at the beginning, we'll have 2-hour blocks that we will meet on a few days for you to work on these basic interpersonal skills. And that will be prior to meeting with the patient. And once we've done that, we're still trying to figure out when, but that's probably going to happen soon after Labor Day weekend in September. So after we have this intensive training at the beginning for the first 2 weeks, then we just have a regular supervision meeting afterwards. Does that make sense?
Yes, thank you.
Nadia.
Yes, hi. I actually wanted to ask, in terms of the interviews, is it one interview with two parts, or are there two different interviews, one being the
So
video
there,
and the other one with
yeah, there are two
the
parts
situation?
because yeah, there are two parts because so the first one is you'll be doing the simulation interviews, and I want to be able to review them before I meet with you in person. So that's why it's going to be on two separate occasions.
Oh, okay, okay. So it is two occasions.
Yeah.
That's what I understood when you were talking. Okay, thank
Okay.
you.
No problem. Other questions or comments?
There.
Sabine.
Hi, I was thinking about like the trans theoretical model of change. Um,
Yes.
and I was wondering, because I know that people's readiness to change can kind of impact the success of
Yes.
intervention sometimes. I was wondering for this study if participants are kind of selected based on their stage in the model, or at least like I'm assuming that if they're willing to
Yeah.
participate in the study, then they're likely beyond the pre-contemplation
Uh-huh.
phase already.
Yeah.
But given that the change process isn't necessarily linear, and they move back and forth, I was just wondering if the study is like accounting for or assessing the dynamics throughout the intervention at all.
Yeah, that's a very good question. So the first thing is that at least for the patient, if they sign up for the studies, that because they have some intention to increase their physical activity, and they might be feeling more of the pressure because of the diabetes. Now, for the partner, their level of motivation or readiness to change might be quite variable, and that's why we use a motivational interviewing framework. That's where we really take them where they're at, and then we say, can we move them along the process? So that's the use of the motivational framework, and we know also that people can move like the it's not linear. They go back and forth in terms of their readiness to change, and we use the motivational and interviewing strategies to address this.
Thank you.
um I'm not sure about the order. I think Samantha's next.
Thank you. Yes, just a quick question. Thank you for the presentation. Looks like a really great project. My question was about the training sessions at the beginning. I understand
Yeah.
that these sessions with the couples are going to be either online or in person, depending on the preference of the patient participant. But for the training sessions, is that also mostly online, or will there be components for in person at the beginning?
Yeah, I think we will do them all online.
Got it. Okay. That's it.
Thank you.
Thank you.
Leo.
Hi, can you hear me? Yeah.
Yes.
Okay. First, thank you for the presentation. Merci beaucoup. So you had mentioned the intervention is informed by motivational interviewing, family systems theory, and also there was something about it was like the
Health
health
behavior
behavior.
change. Yeah,
Okay.
strategies.
Okay. And also I was wondering, it seems like a very interesting project, and I was just hearing you talking about it. I was wondering if it was possible, if there's anywhere we can kind of read a little bit more on the project, or maybe the previous project that led to this.
I mean, not yet. I'll tell you why, because we're in the process of writing the publication for the prior project. And then the other one, really, we're just starting, so we don't have something. What I could send you is a review paper, but that's not directly related on the intervention. It's more the interpersonal process per se. Um, I'm and just so some of you might be aware, but I'm actually currently on parental leave. So this will be like I'm trying to finish the intervention manual for in the next month, and then we're gonna start the training. It's an adaptation of the we're not creating something new, but it's an adaptation of the other project that we did. So unfortunately, at this point, no. But once
Okay.
it's ready, then I'll be able to do that.
That's good. Thank you.
Gabrielle.
Yeah, I was just wondering, will part of the not interviewing part, but the training, will we be learning a bit more about type 2 diabetes and what could influence whether or not they'll want to participate and increase their physical activity, or could we take that on our own time?
So we will organize something just so that you guys understand, okay, what are the treatments, what are the self-management challenge. For the intervention, we will be focusing mostly on the physical activity aspect. But for example, I think like considering the specific population, just understanding the food intake, we don't want them like how they regulate the food intake in relation to the physical activity. So our physician colleague will actually do a short presentation on this.
Okay, thank you.
No problem. Alex, did you have a question?
Yeah, I saw a couple of questions in the chat, so I wanted to just read them out loud. This comes from Camilla, who has no audio. What are some common challenges you have encountered during the counseling sessions, and how can interns effectively address them?
So that's exactly what the supervision will be about. So for example, if you have a more withdrawn partner, a very critical partner, how will you be, or just partners not being on the same page about what they want, how they want to change things, or not being able to change aspect of their daily routine. But that's exactly the type of issues that we will want to do, and then just maintaining them motivated. I think that's the big, especially if you start with someone that's completely sedentary, not doing a lot of physical activities, and you want to make them move to go from, being a couch potato to be like, and seeing yourself as this, to seeing yourself as someone who's more active. This identity shift is a process. Allison. Kevin, I don't know if you had more questions or if it was in the chat.
There's a second question in the chat. How are the sessions structured when delivered by a team of 2 therapists versus individually?
So that's the same. So basically you just need to agree on, so the sessions are semi-structured. So what this means is that each session there's some themes that has to be covered, but most of it is what's going to be brought by the participant, what kind of challenge that they're facing. So then with the co-therapist, then you kind of decide how you will be kind of sharing the time if you want. Allison.
Hello. I just wanted to know how many participants will be in this study?
So in total, 200.
200, okay. And you said we do max 5 at a time. How many do you think we do over the course of a year?
I would say probably, so these are 3 months. So I would say between 10 to 15.
Okay. Thank you.
Alex.
Hi, yeah. Congratulations on your parental leave.
Thank you.
Yeah, I was just wondering, in terms of, I read up on other similar research and was wondering, after the 6 sessions, do you have a post-op measurement? Like, what's the longest data point that you're measuring to see whether after the 6 sessions, do we have sustainable effects after like a year or 6 months or?
Yeah. So 6 months. So it's 6 months that we have. And here, I think like we wanted to have a 1-year follow-up like in our other study, but the funding is just not there, because if we like in terms of the a clinical trial, in order to do the 1-year follow-up, we would need to be able to run all the participants in the first 2 years, so that the last 1-year follow-up is completed within the 30 of the grant. And it's just challenging to be able when you start a new project like that. So the idea is that this is it's a first step. It's still a 200 people trial, but then I think if we get good results, then we'll apply for another grant to get longer follow-ups.
And is it okay if I ask more than one question?
Yes, of course.
And I was looking at other studies that had joint dyadic behavior change techniques that like were long-term effective. had a lot of like objective measures set up to look at like improvement over time and stuff like that. Are we gonna have any like step counters? I know that can create pressure for some people to like
Yep.
are we yeah, we do. And
Yes, and actually that's a great question. So we'll have two objective measures. So one of them is their glycated hemoglobin. So that's actually a measure of blood sugar control over the past 3 months, more or less. So one of our main outcome is how does the intervention impact their glycemic control? And then the other one is that we're going to give a Fitbit to everyone, and we're going to look at change in step count over time. And in our weekly supervision, we're also going to choose the couples that are progressing less so that we can spend more time with the couples that we see are struggling more.
okay, well. And in terms of the pre-screening process, I was wondering whether there's any data on like I also saw that like as I think it was Sabine mentioned like how good the couple's relationship dynamic is can impact a lot of the success of behavior change in dyadic couples. So do we know like is there any pre-screening questions about whether any of the members of the couple have other mental health conditions or how strong their couple is, so we could like know going into it what things or
Okay, so that's a great question. So there's different ways in which we're dealing with this. Part of it is that we're doing what it calls the Bayesian adaptive trial design. Is that and basically what this means is we're going to group people as a function of two big categories. So are they high and low in marital quality or marital satisfaction when they start with? So that's one of the big factors. And the other factor is whether they are concordant on obesity. So in that population with type 2 diabetes, we know that obesity is a significant risk factors. And then one of the things that we want to explore is, do we see the same dynamics if your partner is leaner than you, or if you guys share the obesity risk factors for this? And then with this combination, then we're going to be able to assess, is the intervention more or less effective as a support? So we don't screen for that. So actually we want to make the intervention quite open to sort of like almost everyone, like it would be in real life, to maintain the ecological validity. But we're going to have ways to assess if the intervention is more or less effective in some of these groups.
Awesome. Well, thank you very much, Igor, for the interview process.
Thank you. Camila, do you have another questions? I just see your hands up. Or I don't know if there's one in the chat. Let me look.
No, there's nothing in the chat.
Okay. Nadia, do you have another question?
Yes. So I wanted to ask, I mean, just because we're talking so much about the participants, how do we select participants that can do this study? Because I understand it is like a couple intervention. So I don't know if you're allowed to even talk about the process technically. I was just wondering.
Yeah, so we don't really select them. We select them based on the fact that they have type 2 diabetes, and then we're gonna send the letters on behalf of their physician saying there's this project going on. Are you interested in participating? And that's it.
Okay, so this is why we're not sure about how much their partner wants to be involved. Okay,
Yep.
that makes a lot of sense. Thank you.
But when they do start, both partners have to provide consent so that they know what they're getting into.
Okay, yeah, that would make sense. All right, thank you.
Leo.
So my question relates to the motivational interviewing component of the intervention. I know that with this approach, there are objective measures in the supervision process of looking at whether you're really doing motivational interviewing or not, counting reflections, open-ended questions, things like that. And I was just wondering if that's part of the supervision process, or what the supervision process will look like.
Yeah, so so we won't be necessarily looking at adherence to motivational interviewing, but I think in So the supervision process will be more based on problems that you're facing. So the first thing would be either like if you have a couple that I'm like, oh, like I don't know how to deal with this situation. So that would be the first thing where we would discuss this in supervision, or if we see that a couple is stagnating or decreasing their step count, because we'll have the step count data. So then we'll say, okay, maybe we need to look into what's going on, and then we would. So it's more problem based, and then from this problem based supervision, we look at, okay, what are the processes going on in terms of either the intervention that's being delivered or whatever other issues might be happening.
Thank you.
Other questions? Yes, Alex.
You mentioned that the participants may be Anglophone or Francophone. This means that the therapies can be in both languages?
Yes.
Okay, and will the training be in English or in French?
I think, let's see, either, both. I think we'll be flexible based on who we have around the table, if people prefers English or French. Yeah. Yes, Isabelle.
Just going off of the question that Alex asked, if we are doing the training in only one language, will we be made aware of certain terms that are important to know for the therapy in both languages?
Yeah.
Okay, perfect.
Yes, absolutely. We'll practice in both, and like, you know, I think the idea is that if you feel more comfortable in French, like I will assign you a first couple, francophone couple, right? So I think we're gonna go also gradually like that. Like my goal is for you guys to be effective interventionists, right? So we're gonna create the condition of success. Of course, we're gonna go in the language that you're more familiar in that sense. Yes, Leo.
Yeah, relating to the weekly meetings, these will be happening in person?
I think we'll just do them online.
Online? Okay. The supervision will be online.
Yeah.
Did I have another question? I don't think so. Yeah. Okay, perfect. Thank you.
Yeah, I guess the one technical issues that we're trying to figure out is whether we can have split screen if let's say you're doing co-therapy in 2 different locations and then you have a couple in a third location. Can we have a split screen where they see both of the interventionists at once and then you guys see the couple? So, but that we've not figured this out yet. But that's a potential issue that we would be wanting to solve. Okay, well, thank you guys for attending. These were really great questions. We're really excited to see you guys for the next step of the interviews. And we'll be, like I said, I think the next step is we'll be sending you emails that will allow you to then schedule in your interviews. So that will be avoiding sort of the back and forth. And what so, and also I need to tell you that we got much more applicant than we had anticipated. We got 88 applicants, so that's why it took us so long. So really probably that the interview process will go up until sort of early mid-August, but by that time I'm hoping to let everyone know whether they're accepted so that they can plan for the fall. Well, thank you everyone for attending.
Thank
Have
you.
a good evening.
Thank you.
you.